Let's check in with Dr. Harry Nespolon now, who's the president of the Royal Australian College of GPs. Thanks for joining us again, Harry. First up, I'm keen to hear how GPs are going with the new ability to have teleconsultations, dealing with patients via Skype or over the phone. Is this being adopted in a widespread fashion? Is it working well?
Well, it's absolutely new for doctors here in Australia, GPs in Australia, using telehealth telephone consultations, but they've been entirely welcomed. As you may have seen today, the Minister is going to be working towards making sure they're available for all medical problems, not just coronavirus problems, and that's really going to help GPs both with capacity and their anxiety in dealing with patients who may be unwell.
Yeah, I think this is the key point, isn't it? Because we've all focused on the fact that it means you don't have to have face-to-face contact, so it reduces that chance of infection in the surgery. But of course, at a time when there's going to be heavy demand on GPs, it should be able to allow them to deal with each issue perhaps more quickly.
Absolutely. So not all consultations require you to be, have a patient sitting in front of you, and this allows certainly much more efficient dealing with patients, and also it allows us to be safe, allows our staff and other patients who need to be in the practice to be safe, and as importantly, it also saves on personal protection equipment like masks.
Now, the flu vaccine is being rolled out over coming weeks. This will be seen as very crucial, particularly for those who are most vulnerable.
Absolutely, and it's really important that your viewers, if they are particularly, well, in fact, all viewers should consider getting their flu shots. The last thing we need is a sort of a bad flu epidemic on top of the coronavirus requirements for our hospitals. So I'd be strongly suggesting that people, as soon as they're able to access their flu shots, that they go out and get them done.
And it's also, presumably because of the similarities in symptoms, anybody gets the flu or flu-like symptoms is going to have to treat it as coronavirus until they know otherwise.
And that's another issue, which is the test that you use for, the test kit that you use for coronavirus is exactly the same test that you use for flu, and so we really don't want to be using a whole lot of test kits for something that we can prevent in the flu and use it for the coronavirus patients or the potential coronavirus patients.
Now, if we do look at having high numbers of people requiring hospitalisation or acute care, we know that the resources in our hospitals could well be stretched, and they're looking at additional facilities, perhaps in hotels, perhaps in ships, whatever. The question, though, is whether we have the medicos, the doctors and nurses to staff this additional capacity. Is there untapped resources in our community, retired doctors, retired nurses?
Well, there certainly are obviously retired doctors and retired nurses out there, but part of the problem is that usually the retired doctors and the retired nurses are the ones who are going to be most vulnerable to coronavirus. So we would presume that if those staff are brought back in, they pour in background roles. I mean, they certainly do add to the capacity of the system.
But we're starting to look at preparations. We're starting to look at logistics to prep for this, because it's something that could be headed our way in 1 month, in 2 months.
Certainly, I know the Western Australians are already advertising for retired doctors. The medical board is going to try and streamline re-registering retired doctors. So we are looking at it already, and that's a good thing.
Thanks for your time, Doctor. I appreciate it.